Noticing a rash on your baby's skin can be worrying, especially if you're a new parent or if it's your first time seeing something unusual on your little one. It's completely natural to feel a bit anxious or unsure about what to do next. The good news is that most rashes in babies are common and harmless, and they often clear up on their own with a little care and attention. Babies have incredibly sensitive skin, and their immune systems are still developing, so it's not unusual for them to get rashes from time to time. These skin changes are often just a normal part of growing up and exploring the world. The key is learning how to tell when a rash is mild and can be managed at home, and when it might be a sign that your baby needs to see a doctor for further advice. This gentle guide will help you spot the differences between the most common baby rashes and those that may need medical care, so you can feel more prepared and less stressed. We'll walk you through rashes like scarlet fever, measles, and heat rash, explaining what causes them, what they look like, and the steps you can take to help your baby feel better. You don't need to be a medical expert to care for your baby's skin, just informed, observant, and willing to trust your instincts. Trust your instincts, you know your baby best, and your care and attention make all the difference. We'll break down the information in simple, easy-to-understand steps, so you can feel more confident and less anxious about what you're seeing. By understanding the signs and symptoms, you'll be able to decide if your baby just needs some comfort and home care, or if it's time to call your GP for extra support. Let's start by looking at scarlet fever. What it is, how it appears, and what you should do if you notice it. Remember, you're doing a wonderful job by staying informed and looking out for your baby's health and happiness. Help is always available if you need it. Let's begin this journey together and make sure you feel supported every step of the way. Scarlet fever is a bacterial infection caused by group A Streptococcus, the same bacteria behind strep throat. It starts with a sore throat, headache, fever, and tiredness, followed by a distinctive rash. The rash feels rough, like sandpaper, and usually starts on the chest or tummy before spreading. On darker skin, you may feel the texture more than see the color. Look for a strawberry tongue, red, bumpy, and sometimes coated white at first. If you suspect scarlet fever, see a doctor for antibiotics. This speeds recovery and prevents complications. Keep your child comfortable with fluids, soft foods, and paracetamol for fever. Measles is a highly contagious viral illness that can affect anyone, but it's especially dangerous for babies and young children. It spreads easily through tiny droplets in the air when an infected person coughs or sneezes, making it one of the most infectious diseases known. Thanks to the MMR vaccine, measles is now rare in many countries, but outbreaks can still happen if vaccination rates drop, or if people travel from areas where measles is more common. That's why it's still so important to recognize the signs and act quickly if you suspect your child might have measles. Early symptoms can look like a bad cold or flu, a high fever, a runny nose, a persistent cough, and red, sensitive, watery eyes that may be uncomfortable for your baby. One of the earliest and most distinctive signs is the appearance of tiny white spots, called Koplik's spots, inside the mouth, often on the inner cheeks. Soon after, a rash appears, usually starting on the face or just behind the ears as small, red-brown spots that may join together. The rash then spreads down the body, covering the neck, torso, arms, and legs, forming large, blotchy patches that can look alarming. Although the rash itself isn't usually itchy, your baby will likely feel very unwell, tired, and irritable, and may not want to eat or drink. If you suspect measles, call your doctor or NHS 111 immediately for advice. Don't visit a clinic or surgery in person without calling first, as measles spreads very easily to others, especially those who aren't vaccinated. Antibiotics won't help, since measles is caused by a virus. But medical guidance is crucial because measles can sometimes lead to serious complications, such as pneumonia or encephalitis. The best way to protect your child is through vaccination. The MMR vaccine is safe, effective, and gives long-lasting protection against measles, mumps, and rubella. Heat rash, also known as prickly heat, is a very common skin condition in babies and young children, and thankfully, it's not serious or dangerous. Many parents notice it during the warmer months or after their baby has been bundled up a bit too much. This rash happens when sweat ducts become blocked, trapping sweat under the skin. It's most likely to occur in hot, humid weather, or if your baby is overdressed or bundled up in too many layers, making it hard for their skin to breathe. You'll usually notice tiny red spots, small bumps, or even clear blisters in areas where sweat collects. like the neck, armpits, chest, back, or the nappy area. These spots can sometimes look a bit angry, but they're usually harmless. The rash may feel prickly, tingly, or itchy for your baby, but otherwise, your little one will seem perfectly well. There's no fever, no signs of illness, and your baby will still be happy and active. To help your baby feel better, move them to a cooler room, gently remove any extra layers of clothing, and give them a soothing, lukewarm bath. This helps cool the skin and ease discomfort. After the bath, let your baby's skin air dry or gently pat it dry with a soft towel. Avoid using creams or lotions that could block pores and make the rash worse. Dress your baby in light, loose-fitting, breathable clothes made from natural fabrics like cotton, and keep their room cool and well-ventilated to prevent overheating. With these simple steps, heat rash usually fades away quickly, often within a few days, once your baby's skin has a chance to cool down and breathe. Remember, heat rash is just your baby's way of telling you they're a bit too warm. By keeping them cool and comfortable, you can help prevent it from coming back. Let's compare the rashes side by side for clarity. Scarlet fever, rough, sandpaper rash on chest, tummy, with fever and strawberry tongue. See a doctor. Measles, blotchy red-brown rash starting on the face with cold-like symptoms. Call your doctor or NHS 111 urgently. Heat rash, tiny prickly spots in sweaty areas. Baby otherwise well, cool them down at home. If your baby seems unwell with a rash, seek medical advice. If they're happy and only have a heat rash, home care is usually enough. Knowing these differences helps you act calmly and effectively. It's about being prepared, not scared. Always trust your instincts. If your baby seems off, call your doctor or NHS 111. Seek urgent help if your baby is under 3 months with a fever over 38 degrees C, or over 3 months with a fever over 39 degrees C and a new rash. Watch for trouble feeding, breathing difficulties, dehydration, or unusual sleepiness. Do the glass test. If a rash doesn't fade under pressure, seek emergency help for possible meningitis. Don't hesitate to get professional advice. It's always better to be safe. This guide helps you spot common rashes, but doesn't replace a doctor's care. Parenting is about learning and asking for help when needed. Trust yourself. You've got this.